Good evening. The provincial government is facing calls tonight to give hospital patients and their families a break. Critics are accusing the government of allowing hospital parking fees to create a burden on people dealing with illness. Al Sweeney has more.
Debbie MacGregor's mom passed away earlier this year after a 7-year struggle with cancer. And over that time, Debbie accumulated a stack of parking receipts.
So the thousands and thousands of dollars that my daughter and I figured it's like more than $7,000 that we spent on parking just to be with my mom.
Those parking fees added to the stress of dealing with a loved one's illness.
And I miss her. And now this weekend is Mother's Day. It's my first Mother's Day without her.
Cancer costs the average patient in Canada nearly $33,000 over the course of their lifetime.
The Canadian Cancer Society says half of that cost of cancer is out-of-pocket expenses, including parking. They're supporting the Ontario NDP's call for free parking for people going to hospitals.
We're talking about a tax on sick people. No one should have to worry about paying for parking when they go to the hospital.
The Nova Scotia government banned hospital parking fees this month. Premier Tim Houston says Nova Scotians shouldn't have to worry about parking fees when they're sick and seeking health care or caring for our loved ones. Like Nova Scotia, the NDP is calling on Ontario to provide free hospital parking.
I believe it's the responsibility of the provincial government to make sure that they fund our hospitals so they don't have to charge parking fees. That people go to the hospital, they're going there out of necessity. It's not like it's a vacation.
You know, we're investing in our world-class healthcare system. We're investing record amounts in our healthcare.
The provincial government says it's already making record investments in hospitals.
I understand that there are challenges when people want and need to visit our hospitals, but there is also the other side where we want to invest in people, in equipment, in capital.
Part of the argument against free parking is that passes and programs are available to help reduce parking costs. Debbie MacGregor says no one offered her a break.
Why are we having to have the extra expenses like on top of everything else? We should not have to pay for parking, and the staff should not have to pay for parking.
So there's also the argument that parking money goes into hospitals. But the NDP says that's only part of the money. They say third parties operating the parking lots also get their share, and Wayne Gates says he hasn't been able to find out how much that share is.